you treat a prostate cancer patient with an early disease, you can treat him very well with either radical prostatectomy, external beam radiation, or brachytherapy. Over the last 25 years, we've treated many patients with early disease, and the likelihood that they get cured with the brachytherapy of their cancer is way above 90%. So, depending on the PSA, depending on the Gleason score, the aggressiveness of the tumor, depending on the size of the tumor. If you find the tumor early, the likelihood that the patient survives the next 15 years and not die of prostate cancer is above 98%. If you compare the patients in Europe to the patients in Kenya, we've been coming here since 2017, and we've seen a change in the diagnosis of the patients. In 2017, most of the patients were diagnosed too late. They had a high PSA, they were coming in when they had symptoms, which usually is that they have an advanced tumor and they cannot be cured. It's a palliative treatment. And since then, we've been coming back, and we've seen that the screening has become more efficient in Kenya, and we find that most of the patients we see nowadays are early tumors. And those early tumor patients can be treated well with brachytherapy. Very effective. And from the start in 2017 until then, more than 100 patients have been done here, and the technique increased significantly. The quality of the technique increased significantly. The number of patients that we treated per year increased significantly because better diagnosis. We have been training brachytherapy centers for the last 20 years, and we've been trained about 100 different centers in more than 10 different countries, and Kenya is the only country sub-Saharan that we've been training. Most centers we did in Italy and Switzerland, Austria, and then other European countries, then going into the Baltic states and Russia. But the Nairobi Hospital approached us in 2016, and they wanted to learn the technique, and they came over to see us in Berlin to get some training in our side, do some theoretical training, do some practical training, and then they invited us to come here to start the program going together here.
The biggest difference is, one, the time it takes to get you treated.
In terms of
As in, you need to be admitted for a number of days. In this case, you need just 1 day's admission. Two, the surgery is always very invasive. There is no way you're going to reach the prostate without cutting you. Whether you're going to cut using even the best methods, you've heard of the robotic approaches where you can go with a robot, get inside the body, you're still going to cut the prostate out. There are structures you're going to remove permanently, like the seminovesicles and the tubes that carry sperms, the vasti. You remove those ones at radical surgery. So that removes the possibility of children completely and reduces ejaculation. While at radiotherapy, the other types of radiotherapy, you damage those tubes permanently, but you may have the possibility of producing children. But for brachytherapy, the injury to those tissues is minimal. The injury to the other tissues, which is why we say we've had very little side effect, the injury to the rectum, the injury to the bladder, the injury to the bones, and even bowel is minimal with this treatment, which does not radiate things which are more than 2 to 3 centimeters away from it.